Hello, I'm Jackie Roth, publisher and executive editor of Maryland Physician Magazine. Your practice, your life. Welcome to Physician Spotlight. To celebrate November as National Hospice Month, we're spotlighting Dr. Lou Lukas, Chief Medical Officer of Hospice of the Chesapeake. As an advocate of hospice care and as a member of Hospice of the Chesapeake Foundation Board, I'm delighted to celebrate Dr. Lukas and hospice and palliative care providers across the state of Maryland.
I'm Lou Lukas, and I'm the Chief Medical Officer for Hospice of the Chesapeake. I joined the organization in April of 2011. Hospice is a way of providing compassionate, holistic care to people who are reaching the ends of their lives. It deals with people in their physical circumstances, their physical symptoms, as well as their relationships with their families, their emotions, and how their family are going to come together around these issues. Hospice of the Chesapeake is a really unique organization because of both where it's located and the kind of organization it is. It's very deeply rooted in the community. They've been here for over 30 years, and they're really a dominant player in their market. And it allows us to be in a position to serve the needs of the community in a way that many organizations aren't able. We can work with the hospitals to think about how do we provide the best possible care for people who are living with advanced complex illness. We all know our hospitals are very full and very busy, and a lot of times they're full with patients who are reaching the ends of their lives. And so with hospice at the table, we're able to actually think about not only how do we introduce patients to hospice particularly, but how do we build programs together so that we can bridge the gaps between curative care and the comfort care that we offer towards the end. What's special about Hospice of the Chesapeake in particular is that our bereavement services are available to anyone in the community, regardless of whether the patient was in hospice or not. The one that I think is the most unique is called the Life Center, and it's our center for counseling and bereavement. That's the part of hospice that's available for people after the patient has passed, but the family member is still dealing with the grief and loss. We have a number of new programs that are innovative and that really serve the needs of our community. The first is our perinatal program, which is designed to help couples who are expecting the birth of a child who has a condition that's not compatible with life outside the womb. We have a new pediatric program designed to help take care of children who have life-limiting diagnosis. We're also expanding our Mandarin facility. It's now called the Mandarin Inpatient Care Center, and it's designed to offer hospital-level services to patients who are having symptoms that can't be treated safely in their home setting. We're also very excited to announce our purchase of a new property in Pasadena, Maryland. It will bring our campus into the middle of Anne Arundel County. It's a 6.5-acre campus that is heavily wooded and allows us to build a really special space to contain all of our programs. I'm the Chief Medical Officer, so I'm responsible for all the medical care, but the real hard workers on the front line are our nurses, social workers, chaplains, nursing assistants, and volunteers who go primarily into patients' home and do work that's hard for a lot of us to imagine. Taking care of patients who are reaching the ends of their lives is very challenging. So it's really wonderful to have the opportunity to celebrate nationally with all of the other hospices around the country to draw attention to the great people who do this work. My goal is to help us provide the very best medical care possible, but also to expand our relationships with the medical practitioners in our community and the medical institutions so that our partners can come together and think about how we take care of patients who are reaching the ends of their lives in our community. Hospice is a place that's able to recognize the difficult truths of life, which is that all lives come to an end. But how do we take that time in patients' lives and make it really meaningful? If we're able to treat their symptoms, if we're able to treat the anxieties and fears of their families, it's an opportunity for those few months of a patient's life to be transformative.